Knock knock.
Come in.
Hi, I'm Brianna. I'll be your student nurse today. We'll do some hand hygiene and do some privacy for you, okay?
Okay.
Can you verify your name and date of birth for me?
Yes. Jane Doe 1 2 3 4 5 6.
Okay, is it okay if I touch you, Miss Jane Doe?
Mhm.
Alright, I'm gonna check your wristband. Okay, perfect. Alright, I'm gonna check some orders from the doctor. So the doctor has ordered for me to do some different assessments on you. We're gonna do a neuro assessment, a respiratory, cardiac, gastro, musculoskeletal, and genitourinary, okay? Is that okay? Are you taking any medication? Are you allergic to anything? No? Alright, so we'll just start out with your neuro assessment first, okay? So I'm just gonna assess first, I'm sorry. So eyes, face, ears, nose, lips, everything looks symmetric. Have you had any headaches recently?
No.
Okay, any runny nose? Any trouble swallowing? No. What about any recent ear infections? No. Okay, so I'm just going to look into your ears really fast, okay? Alright. No redness, normal cerebral present. I'm gonna check in this here. No redness and normal cerebral in that ear. Alright, so now I'm just gonna check your pupils and stuff, okay? So pupils are about a 4 right now. Alright, so I'm just gonna shine this light into your eyes, okay? Just look straight ahead for me. Alright, now you'll just follow this light the pin light for me, okay? Oops, sorry. Alright, so pupils are equal, round, reactive, accommodation to light, now can I just get you to hold one nostril for me and blow? Okay, and the other nostril and blow? Alright, and then if I get you to swallow for me? Okay, so trachea is midline to the body, and if I can get you to smile? Okay, so teeth and open wide for me, okay?
Babe, I got some gums, okay?
That's okay. Alright, mucous membranes are pink, intact, moist, no cavities. Alright, so that's, I'm gonna do a hearing test on you really fast, okay? So I'm gonna stand behind you on each side. I'm gonna say a few things and just repeat back to me what you hear, okay?
1 2 3 4 5.
Okay, now we'll come on this side.
6 7 8 9 10.
Okay, so hearing is good, and you're speaking to me, so your verbal is all good. So next I'm just going to move on to your respiratory assessment, okay? Have you had any shortness of breath or cough?
Nope.
Okay, any mucus when you cough, or you coughing up any mucus or anything like that? Okay, alright. I'm just going to listen to some different breath sounds, okay? I'm going to start in her right upper lobe. Just take some deep breaths when you feel this thing. Left upper lobe, left upper lobe. And if you'll just displace your breath for me. Left lower lobe. And I'm gonna come over here to her left lower lobe. And if you'll displace this breath for me to your right middle lobe. And I'm gonna come over here to your right lower lobe. Okay, so now I'm gonna listen to some on your back, okay? So I'm in her right upper lobe, left upper lobe, left lower lobe, right lower lobe. Okay, so no adventitious lung sounds bilaterally, so all of that sounded good. So really fast, I'm going to educate you on this symptom spirometer. So, Mrs. Jane Doe, this is a symptom spirometer. It's just going to help clear any mucus that you have in your lungs and stuff, okay? So if you would just hold this for me, you're going to take a deep breath for 2 to 5 seconds, and you're going to exhale. And you're going to do this 10 times every hour, okay? So I'm going to let you practice doing a deep breath. Perfect. And can you just repeat back to me what I just taught you?
Yep, breathe in 2 to 5, hold it for 2 to 5 seconds, and then exhale, and we do it 10 times an hour.
Yes, alright, so I'm just gonna put this on your bedside table. And if you are a bedridden patient, I would get you to do a turn, cough, and deep breath. So what you would do every 2 hours, you would turn on your side, so that you start on your left side, you would cough and take a deep breath, and then 2 hours later, you would turn to your other side, okay? So that's going to be it for your respiratory assessment. All of that sounded good. Now I'm going to move on to your cardiac, okay? Have you had any chest pains? No? Alright, I'm going to listen to some different valves, okay?
Okay.
Let's start in her aortic valve, her pulmonic valve, Erb's point, tricuspid valve, and then her mitral valve. Okay, and then I'm just going to listen to your apical pulse down here for about 30 seconds, okay? Apical pulse was about a 64 beats per minute, okay? So I'm just going to check for some capillary refills. You'll just put your hands out like this. Okay, capillary refills are less than 3 seconds. I'm just going to check for some edema, so if you put your hands out like this for me. Okay, and I'm going to do your legs now. A leg.
Babe, I feel leg pain.
So, no edema present, and I'm going to check for JVD. I would have you sit at a 45-degree angle, and if you look this way, perfect. Perfect, so no JVD present. Now I'm going to check some different pulses really fast. So I'm going to start with your radial pulse. And I would do this bilaterally. Then I would check her posterior tibial pulse, and I would also do this bilaterally. And then her dorsalis pedis pulse, and I would do this bilaterally. Okay, so all pulses are regular, strong, +2. Some different pulses that I could assess for Miss Jane Doe is her carotid right here, her axillary right here, her brachial, or her popliteal behind her knee, and also her femoral and her groin area. So all of that's good for your cardiac assessment today. Now have you had, when was your last bowel movement?
This morning.
This morning, okay. Was it regular, irregular?
It was regular.
Okay. Have you had any abdominal pain?
Yes, ma'am, this morning too.
Okay. Alright, so I'm just going to listen to some different bowel sounds, okay?
Okay.
I'm going to start in your right lower quadrant, okay? The right upper quadrant, left upper quadrant, left lower quadrant. Okay, so that's normal active bowel sounds. So all of you said was it irregular or regular this morning? I'm sorry. Regular. Okay. And now I'm gonna get you to do a musoskeletal assessment really fast. If I could just get you to stand up really fast for me.
Okay.
All right. And if you'll just take a few steps for me, and on your way back, if you'll just do heel to toe. perfect. Gait and balance is good. And I'm just gonna do some range of motions with you really fast. So your first range of motion, we're gonna do 2 on your upper and 2 on your lower. So the first one, we're just gonna do your elbow out like this, and this is going to be flexion and extension. And then if you'll do your fingers like this for me, and if you'll open them up, that's going to be abduction, and together is adduction, okay? And with your lower extremities, if you would just take one leg and go out like this, right here at your hip, and that's also going to be abduction, and back down, it's going to be adduction, okay? And then if you would just flex your knee up, that would be flexion, and down would be extension, okay? Have you had any falls recently? No?
Not yet.
Okay. So you can go ahead and real fast with your with the neuroskeletal. Her neuro exam. I should have done her sway test. So really fast, I'll just go ahead and assess that. If you'll just close your eyes for me. All right, you're good. You can open up. So no swaying. You were all good there. You can go have a seat for me, Mrs. Jane Doe. Have you had any trouble urinating recently? All right. Is your what color does your urine usually appear?
Slightly yellow.
Slightly yellow. Is there any odor to it? No. Okay. All right. Well, I'm going to. Have you had any past medical history? No. All right. Well, I'm just going to educate you on some patient safety really fast. So, for patient safety, we saw that you could walk pretty well with your skeletal, so I don't think you're a fall risk. Make sure your bed is at a low position and locked. Make sure your call light is within reach. Let's just make sure that the room is decluttered. Make sure that the lights are turned on before you walk so you can see. And let's make sure any cords are tucked away, okay?
Yes, ma'am.
Do you have any questions for me?
Can I go back to sleep now?
You can.
Alright.
I have your table within reach and such a spirometer with your call light on there. If you need it for me, just hit the call light, okay? I'm gonna do some hand hygiene and for your privacy. Have a good day.
Bye.
Bye.